Asthma is a common chronic inflammatory condition of the lower airways which may present at any age. It affects over 350 million people worldwide and its prevalence is increasing. Management of asthma has undergone huge changes. New treatment options are available and there are established international guidelines like GINA providing an overview of treatment options and strategies. And that's why EUFOREA is thrilled to announce its new Asthma Pocket Guide with treatment guidance for clinicians. Its aim to improve patient care. This is EUFOREA News broadcasting from London. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Asthma remains a common chronic respiratory disease. Patients suffer from respiratory symptoms such as cough, dyspnea, wheeze and chest tightness. To ensure optimum care of these patients, it's really important that clinicians have the latest data and treatment algorithms available to them. And that is why EUFOREA has launched a series of pocket guides, the latest of which is a newly developed Asthma Pocket Guide. It focuses on adults and is aimed at all those physicians seeing asthma patients. It's a mine of information and it walks clinicians through every aspect of the disease, explaining how to identify symptoms and signs consistent with the diagnosis of asthma and its most common comorbidities. It provides a list of the major differential diagnoses, the most important diagnostic tests, the key treatable traits and point-of-care biomarkers. And crucially, it details the most common non-pharmacological and pharmacological treatment options and also gives a practical guide as and when to refer to a specialist. Well, here to tell us more about this groundbreaking pocket guide is Professor Zuzanna Diamant. She works in Groningen in the Netherlands and is guest professor in asthma and allergy research at the Department of Respiratory Medicine and Allergology at Skåne University in Lund in Sweden. She is also the chair of the EUFOREA Asthma Expert Panel. Very good to see you. Thank you very much for joining me. So, can you tell us about the EUFOREA Asthma Pocket Guide? Why was it conceived and who's it for?
Thank you very much for this kind introduction, David. I think it's very good to highlight what the Pocket Guide is for. So this is pretty much a very nice extension, I would say, of the previous EUFOREA Pocket Guides referring to the upper airway diseases like allergic rhinitis and chronic rhinosinusitis. So the Pocket Guide here of EUFOREA pretty much aims to bridge the gap between the very comprehensive pocket guides that we already have out there, which are of course very important, but pretty much aimed for a medical specialist, for respiratory specialists, so to say, while the EUFOREA Pocket Guide aims to fill the gap for the generalists, so the non-specialists like general practitioners, but also the pharmacists, the nurses, and patients as well. So this pocket guide aims to highlight the differential diagnosis, the simple tests, the point of care tests, but also provides short summaries of differential diagnosis, the treatable traits, also explains what comorbidities are and how we could also involve and implement them in the present management of asthma, and that we should not forget. And it also provides short summaries of the concurrent non-pharmacological and pharmacological possibilities of treatment. What's also important that this pocket guide foresees in a kind of handout for the generalist at what point it is important to consider referral and to what specialist. So in this quite simple algorithm, this pocket guide foresees a kind of asthma in a nutshell and the management possibilities and when to refer, if you wish.
I was really struck, actually, as you say, it is really comprehensive. As you rightly say, it kind of walks you through the symptoms, the differential diagnoses, the comorbidities, and so on. How has it been received on the ground?
Yeah, that's also very nice to say. So we had quite a few downloads already from the start when it was launched, and we keep on receiving positive responses. But you have to take into account that we just launched it like 1 month ago. So we still hope that we can kind of make a better launch with this announcement, if you wish. And we will also publish a short letter to the editor in respiratory medicine sooner or later, where we all support this principle, the principle of try to translate very comprehensive guidelines into short, concise nutshell, but we provide also helpful algorithms, so overviews that you can see what you can do in a stepwise manner, what next, and when to refer.
And tell us about the new concepts and the therapeutic developments in the field of asthma.
Yes, thank you, David. I think it is a very exciting time that we're living now, and especially for patients with more severe disease. It is quite interesting to see that more and more we try to dig into the underlying mechanisms, and in this way also identify different asthma subsets where we can also develop, and that's currently ongoing now. It's ongoing every year or two. We get different biologics that are targeting different aspects of the underlying mechanisms. We also see more and more studies coming in on long-term effectiveness of, for instance, allergen immune therapy that can be given to patients with less severe asthma, and with strongly allergy-driven components. So that's also quite good news, because allergen immunotherapy can also help a certain subset of asthma. So that is why it's very important to dig into one's mechanistic backgrounds of asthma and not only focus on the lower airways, but to look more from a holistic view to be able to choose the right treatment for the right patient.
And obviously, this is a very much an emerging field of medicine. I think it's incredibly exciting. Some patients respond better than others, don't they?
Yeah, that is true. I think it's very good to also state the pocket guide that is for us a kind of a center of awareness of a broader audience who are referring and who are dealing with asthma on a daily basis. And from that on, we try to spread the discussion also to the more specialist fields like remission, disease modification, etc. And we involve, apart from our expert panels, also key opinion leaders, but also others who also patients are involved in these discussions from EUFOREA side. We involve a broader audience in these discussions to try to make awareness of asthma at a broader field, but also try to define where we are aiming. So yeah, I think it's a very interesting time for all of us, for the experts, for the generalists, for the patients, and we try at EUFOREA to unite them through these discussions and educations.
Very great pleasure. Thank you very much indeed, Professor Susanna Diamant.
Thank you very much, David. It was a pleasure.
Joining me now is Professor Leif Bjermer. He is Senior Professor in the Department of Respiratory Medicine and Allergology at Lund University in Sweden. He is also a EUFOREA board member and asthma expert panel member. Thank you so much for joining me. Firstly, if I may, your thoughts on the Pocket Guide and how you think it fills a gap in the asthma landscape.
I think it will sort of deepen the understanding and also highlight important things that we have written in the Asthma Pocket Guide. So we think that we have created a quite comprehensive and complete sort of package.
So just in terms of the e-learnings, the idea really to be continuous professional development, I suppose.
Yeah, well, the e-learning has a basic part that is more like introductory that we take them in, and then we have a more advanced part. So I think that you will no matter on what kind of level you are educationally, if you go through this, you will be able to follow all the way.
So let's talk briefly, if we may, about unmet needs in the field of asthma. I think this is something that comes up continually. Do you have any comment to make on that?
Well, yeah, that's something that we stress, and that's, I mean, asthma is for sure a systemic disorder, and asthma and upper airway disease, chronic rhinosinusitis and rhinitis is one example. But we also have other conditions that are sort of comorbid conditions, and it's also referred to the treatable traits. So we try to sort of also map not only the asthma as an organ disorder, but also how to manage the asthma in a broader perspective as a systemic disease.
Now, obviously, we are slap bang in the pollen season here in London. Even in London, the pollen count is incredibly high. What advice should you give or could you give to patients with allergic asthma at this particular point in time?
Well, it's the standard one. You should not run and hyperventilate when it's the pollen count is high. Preferably don't, take your bedclothes out and put them in the sunshine when they're pollen. And also ventilation is very important. And if you wash your hair, maybe it's better to do it in the evening than in the mornings.
And finally, if I may, let's go back to talking about the Pocket Guide. I have been really struck by how comprehensive it is. You talk about the fact it talks all the clinicians through symptomatology, it talks through differential diagnosis, treatment, also crucially when to refer. What's the feedback been on the Pocket Guide?
Well, the feedback from the GPs and specialists has been very good so far. And they really feel that this is something that is missing, and they applaud it. And I think we have now a good strategy. The important thing here is also, of course, to update the guideline continuously and to work on to develop them further. But I think we really have done a good start.
And so I suppose that final point is really valid. It's not just about producing the Pocket Guide now, it's about continually updating it, making sure that there is constant feedback and then revising it, I assume.
Everyone has been involved in the development process, and I think that's the most important thing. This is not a finished end product. It's a very good start. Then we can sort of continue to develop and update, because the area is moving very quickly now.
Well, indeed, a very good start. Thank you so much for your time, Professor Leif Bjerme.
Thank you.
So there you have it. You can see the Asthma Pocket Guide at this web address. And that is it for this EUFOREA News Show. Many thanks to my guests, to Professors Susanna Diamant and Leif Bjerme. Now, you can find more information about EUFOREA and register for the EUFOREA educational events on the euforea.eu website, where you can also sign up to receive the latest news via email. And don't forget to follow us on social media, on YouTube, Twitter, LinkedIn, Instagram and Facebook. Until next time, goodbye.